Good afternoon and welcome to today's webinar. I want to thank you for joining us. My name is Marie Kinsella. I'm the Director of Community Programs at the Partnership for Maternal and Child Health of Northern New Jersey, and we are providing today's program. Our webinar is entitled Community Doula Care, an integral part of maternal and infant health team. So first of all, I'd like to review some information before we get started. The planners and the speakers do not have any financial disclosures to make. Immediately after the webinar ends, as well as in an email, you will be invited to take a post-program evaluation. We will certainly appreciate your feedback, so please complete the survey. To receive a certificate of completion, including one nursing credit hour, you must log in, listen to the entire webinar, and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available on the partnership's website and on the YouTube channel no later than April 5th, 2022. We're going to be muting all attendees' microphones during the presentation, but we would love to hear from you. So please write questions in the question box, and the speaker will respond to as many as possible at the conclusion of the presentation. And now for the wonderful fun part. I would like to introduce you to today's speaker. Elizabeth Taylor is a certified full spectrum community doula, childbirth educator, and lactation counselor. Elizabeth Taylor has worked with the New Jersey Department of Health, RWJ Barnabas Health, Weill Cornell, New York Presbyterian Health, and the Rutgers Echo Project team to help effect positive change to maternal and infant health. Welcome, Elizabeth.
Thank you so much, Marie. I really appreciate that intro. And welcome and thank you to everybody for joining me. Really excited everyone took time out to be here today and join me for my discussion on community doula care. So my goal for today is to have all of you take away why community doula care really is such an essential and integral part of maternal and infant health care. By the end of the presentation today, you'll be able to identify what community doula care is, identify the benefits of doula care. You'll be able to explain what comfort measures are and understand how doulas use that in the birthing state. You'll also be able to help facilitate a partnership between doulas and healthcare practitioners in the healthcare setting. I want you to know this is a safe space. It's a space for the exchange of knowledge, ideas, and perspectives. And like Marie said, we're really looking forward to your comments and questions at the end. So let's dive right in. As previously stated, I do not have any conflicts of interest for this particular activity. Let's start with, what is a doula? So a doula is a support person who's trained to educate, and offer emotional, physical comfort to a birthing person before, during, and after childbirth. There are birth doulas, postpartum doulas, death doulas, abortion doulas, even fertility doulas. There are so many specialized niches within the doula field, but today we're going to be specifically focused on community doula care. So a community doula is a doula from a particular community who services and supports that particular community. Community doulas are full spectrum doulas. That means they're with the mamas in the prenatal period through the postpartum period. Prenatally, doulas support the moms by talking about what their concerns are, creating birth plans, going to doctor's appointments, creating exercise regimens for them. In the labor and delivery period, they're going to put that birth plan that was created prenatally into practice. They're going to be utilizing comfort measures, which we'll talk about more in detail a little bit later in the presentation. And they'll be doing mindfulness exercises. In the postpartum period, they do a myriad of tasks. This can be anywhere from meal prep, light housework, and making sure that that mama and that family is supported. And that's what creating a circle means, creating a circle of support for that family. So community doulas are really important because they increase the availability and accessibility to birth equity advocates. The goal of a community doula is to improve birth outcomes in the communities that need it the most. As a Black woman from Essex County, I started my community doula career by servicing the Black and Indigenous people of color population in Essex County, in the area where the Black and Indigenous people of color is the highest, and proportionately, the access to doula care was the lowest. In general, a care model for community doula care looks like a community doula interacting with the mom and the family for 3 prenatal visits, providing uninterrupted birth support, and then attending 2 postpartum visits. Community doulas are also certified to provide lactation assistance support. This can look like assistance with latching, creating feeding schedules, helping to bottle feed and also breastfeed and have the combination of both, talking about tongue ties, how to identify that, when it's important to speak to your healthcare practitioner about a tongue tie, mastitis, issues with engorgement, and a whole host of breastfeeding concerns. Community doulas are also certified to provide childbirth and infant care education. And this can include talking about the changing anatomy and physiology that comes along with pregnancy, what to expect within each of the trimesters, sexual health, reproductive justice, and really what separates community doula care from any other type of doula care is the holistic approach that community doulas take. So what do I mean by that? Community doulas are looking at the whole person. And we actually are uniquely positioned to address concerns outside of the realm of healthcare. So, for example, we can address concerns with food insecurity. Here is a staggering statistic for you. Because of COVID-19, this year, we're slated to have 56% of New Jerseyans struggling with food insecurity, meaning that they may not have enough to eat, may not know where their next meals are coming from. That equates to 1.2 million residents in all 21 counties in New Jersey. So we help, our mamas by giving them information of where they can apply for SNAP, which is the Supplemental Nutrition Assistance Program, or WIC, which is also a food supplement for women, infant, and children. We also help with housing concerns. Maybe they need assistance with Section 8, subsidized housing, in some cases, even shelter placement. We address domestic violence concerns, and we might partner with agencies such as Purple Rain, which is a domestic violence agency that can help with counseling and helping moms go into specifically domestic violence housing. Addressing all of these issues allows for the birthing person to refocus on their health. It also allows for the family to get the resources that they need to be most successful. So now let's talk about what it takes to become a doula. Well, first and foremost, one should have a passion for education, advocacy, and patient care. Community doulas are charged to empower mamas to advocate for themselves and to educate them on the birthing process. So what does training and certification of a doula look like? On average, there's 20 classroom hours that need to be completed. They must attend a minimum of 3 births. They must put together virtual presentations as well as in-person presentations on topics like implicit biases, systemic racism, health equity, just as an example. And then once they're done completing this core curriculum, then they're certified by a certifying body. And in general, the community doula certifying body is Exhaustive Village. There's also Doula, which is an international doula certifying body. So what is the difference between a private doula versus a public doula? Because I'm sure some of you have heard about just doulas and, people come into a hospital or come into a birthing space. And not all doulas are created equal. So a private doula would be someone who's either working for themselves or working for a private doula company. They generally don't accept insurance, and they generally are charging a family anywhere between $850 and $1,700 per birth service. So they don't have the same standard of care practices as a community doula, meaning that care model of the 3 prenatal visits, uninterrupted birth support, and the 2 postpartum visits. It's in their contract, whatever they have come to an agreement with that family. So now switch to the public doula side. A public doula would be a community doula who's servicing the public. They generally are coming from an agency like the New Jersey Department of Health. They do accept insurance, namely Medicaid, and we can dive into that a little bit later. And community doulas are familiar with the community, right? So they're going to know what challenges and concerns that particular community faces, and they're going to know how to address those concerns. It can be concerns like racism, other socioeconomic factors, time constraints, which may sound silly or insignificant, but really can be very impactful. So, for example, if you want to do childbirth education, but you have a family where both mom and dad are currently working 9 to 5 and childbirth education classes are during that time, community doulas could create an evening class for them, create an early morning class for them, or give them access to online classes that are either free or at little cost, right? So creating a sense of community versus uplifting the community. So community doulas create community by creating a support system. They also create community by giving access to resources and educating our mamas about different resources that are available to them and their family. So really, they just want to make sure that they're providing evidence-based findings about the birthing process. This is to ensure that by the end of the education process with the doula, they're able to make, and by them I mean mamas, are able to make informed decisions and give informed consent about their birth journey. So let's talk about doula magic. Why is doula magic important? Community doulas are here to help mitigate the maternal and infant morbidity and mortality crisis. They're here to reduce the racial disparities that occur in the birthing space. So here's some staggering statistics for you. The CDC states that approximately 700 women per year die from pregnancy-related complications. That's at least 700 children that are going to grow up without their mom in the household. A Black woman is 4 times more likely to die from a pregnancy-related cause than any other race, and a Black infant is 3 times more likely to die than any other ethnic group before their first birthday. 3 in 5 of the pregnancy-related deaths are preventable. And I have to say that again because it's just mind-blowing. 3 in 5 of the pregnancy-related deaths are entirely preventable, which is very sad, but then that means that there's room for change. So how is it that a doula can possibly reduce these mortality rates? Doula magic. So these metrics are taken from the Cochrane report. When a doula is involved in care, there's a 25% reduction in the cesarean rate. Why is that significant? Maternal morbidity and mortality after a C-section is nearly 5 times that of a vaginal birth, especially the risk of hemorrhage, sepsis, and amniotic embolism. When a doula is involved in care, there's 30% lower use of Pitocin, 10% lower usage of analgesics, a 70% higher satisfaction rating of a positive birth experience. There's a reduction of the time spent in labor. I mean, worth it for that alone, right? Who doesn't want a shorter labor? On average, labor is 40 minutes shorter with a doula. Babies are born with a higher APGAR score. There's a decreased rate in postpartum depression, higher chest feeding success rate, which is great. We all know colostrum is gold. So the more we can do to make sure babies get that, the better. And comfort measures directly relate to labor changes and labor progression. All of these factors contribute to healthy mom and healthy baby. And all of these factors are why community doulas are essential. So now let's dive into the fun stuff, comfort measures. And we're going to do some of these together. So comfort measures are physical tools and positioning used by a doula to provide pain relief and comfort during the birthing process. Comfort measures can be used in the prenatal period, during labor and delivery, as well as postpartum. Prenatally, the goal of comfort measures is to ease pain associated with the pregnancy. In labor and delivery, it's multifaceted. Comfort measures are used to help refocus, to help distract, to help energize when it's time for pushing, right? And to help alleviate pain. In the postpartum period, comfort measures are help to restructure and rebuild mom and her healing body. They're help to increase endurance and help increase support for both mom and baby. So let's talk about prenatally. What do we do with comfort measures prenatally? This is the period where a community doula creates familiarity with comfort measures and what comfort measures are going to be used in the labor and delivery space. So first, we're going to explain what's going on with the body. And if you see our graphic to the left, inside your pregnant body, I think this is awesome because a lot of mamas, haven't seen this type of anatomy graphic unless it was like high school or even before that, right? So when is the last time that you just randomly have seen your anatomy? So I really like introducing this particular graphic to the mamas that I service. So we're explaining here that, your uterus is expanding. So there's going to be several symptoms that you're going to feel that'll be uncomfortable, like abdominal pain, back pain, vaginal pressure. So we're about to do a comfort measure together. So I'd like to preface this by saying, if you can, I'd like you to stand up, put yourself against the wall or some sort of hard surface. You're going to take and interlock your fingers together, and you're going to take your interlocked hands and put them on your lower abdomen so that your pinky fingers are touching the top of your pelvic bone. Then you're going to press up and into yourself. Now take a deep breath in through your nose, 2, 3, 4, and out through your mouth, 2, 3, 4. Do you feel more relaxed? Do you see how this can help alleviate the pain you may feel in your abdomen, get rid of some of that pressure, some of that vaginal pressure, and then the counter pressure that you're getting and giving yourself from being against the wall is going to help alleviate some of that back pain as well. So I'd also like to go into the different types of comfort measures that there are. That we just did is a self-help comfort measure. There are 6 other categories, which would be partner comfort measures, breath work, mindfulness, distraction, actual use of tools, and movement. So we could spend the entire hour on this alone. I will not do that to you and make it a 2-hour presentation. I'm just going to give you one example of each. And again, we're going to do most of these together. So going back to that first category, which is partner work. If you have a partner with you, you guys can totally do this together. If not, we'll just pretend. So what you would do is you would stand up, and the move we're going to do is called slow dancing. And one person would stand facing the wall, the other person is going to stand in front of them with their back against the stomach part of the person that's first standing. And you're going to do the same thing. So that partner is going to reach around the pregnant mom's belly, interlock the fingers, same placement right above the pubic bone, press in and up and do an abdominal lift. The added benefit of doing this with the birthing person's partner is an increase in the release of oxytocin. So as you're doing the belly lift, the pregnant person would open their legs hip width apart or whatever distance is most comfortable while they're in that abdominal lift. They'll begin to sway side to side, and that's where that slow dancing element comes in. And they would relax back into their partner, take nice deep breaths. And what this would do is it helps to, again, increase that release of oxytocin, increase the contractions, help labor progress. The next category is breath work. We're going to do a chanting breath. And then we're going to use our vowels A and O, and they're going to be pronounced like ah and ooh. So you take a nice deep breath in, and then when you release, you're going to make that ah or ooh sound. So breathe in, 2, 3, 4, and out, ah. What this is doing is the vibration is resonating in our bodies, which is providing us with comfort and relaxation. It's also the relaxation of the jaw is helping open up the vagina and help open up the cervix. Mindfulness is the next category. We'll do a very brief guided meditation. This is my favorite part, so delicious. What we're going to do is we're going to close our eyes, take a nice deep breath in, and I want everyone to draw their attention to their neck. Are you feeling any tension in your neck, in your shoulder area? I'd like you to move your head side to side. Keep breathing in. And on the exhale, really release any tension or stress you may be feeling in your neck. And we would do that type of meditation head to toe. The next comfort measure is distraction. This is the simplest one. When a mother is in labor or having labor pains, we talk about something else. So again, during that prenatal visit, we would build rapport with the mom so we'd know something that's like her favorite topic to talk about. So as she's going through a contraction, we would be talking about whatever that topic is. Tools. One of our favorite doula tools is a rebozo. And what that is, it's a very long piece of fabric. So we can use that again. I'm going to go back to the abdominal lift because we're now familiar with that. So we would do that same slow dance stance that we talked about when we talked about partner work. And anyone can do this. It could be the doula using the rebozo tool. The doula can teach the partner, grandma, uncle, whomever is going to be there to help provide support. So this is a great way to get other people who are part of the mama's support team, who are in her life and who are there to be a part of the birthing process involved. So we would take that rebozo, that cloth, put it underneath her abdomen, and give her some support with an abdominal lift using the rebozo. And then the last category is a lunge. And if we're still standing, awesome job, people. We're going to take our feet and place them right underneath our shoulders. You would step your right foot forward, right in the same line. Bend your right knee and keep your left back knee straight. This is just a traditional lunge. But really what we want to do is we want to help open up the pelvis, help give space for baby to turn and come down. So as opposed to leaving that back knee that's straight and turn in the same direction as your right foot, you're going to turn that left foot out and point it away from you. And now you're able to bend deeper into that lunge with the right knee. And that's going to give you even more space in your pelvis to open up and give room for baby to descend. So using a combination of all of these techniques really helps get mom ready to go and know what we're going to be doing in the labor and delivery room. And I'm just going to briefly mention the last two graphics that we have here. So sitting on a birthing ball, the correct positioning would be when you sit down on the ball, as you can see in the graphic, your knees should be in a 90-degree angle. So if they're a little bit higher, the ball may not be filled up enough. If they're a little bit lower and maybe too full, you'll need to let air out. But this provides assistance with lower back pain. It helps alleviate that. It also helps alleviate vaginal pressure. And then the top graphic of the woman sleeping oh so peacefully would be side lying, and more specifically left side lying. Left side lying is really important. It helps increase oxygenation in the body and oxygenation and blood flow to the fetus. It's also a really great way for your partner or doula to have access to your back, so you can get a nice back massage while you're laying in this position. So let's talk about how we can take all this information and apply it to the labor and delivery space. So in labor and delivery, the main takeaway here is movement and relaxation are key. So we want to make sure that we're utilizing all of the things that we have within the labor and delivery room. So for example, when we're going to do a lunge, we can hold on to the windowsill and give ourselves more stability to really get deep into that lunge. If we're going to be sitting on a birth ball in the labor and delivery room, we can hold on to the edge of the bed and help stabilize ourselves that way. There's also tools within the hospital that we can use, such as the shower. The shower is a great way to provide relaxation. We would call it hydrotherapy, which is the use of water for relaxation. So we could have the pregnant mom face the wall, have the shower head beating down on her back, and that's going to help release tension. It's going to help take her mind off of the contractions, especially at the earlier part of labor before we're actually in active labor. We also have the hospital bed. And as you can see here from the middle, there are several positions that the mom can be in. And these are laboring positions. So we know in terms of laboring, being on our back is not the optimal position, doesn't feel great. So it's really great to take a look at these and see exactly how we can use the stirrups, use the squat bar, use the bed to put mom in a comfortable position for her, and also have the accessibility for the practitioner, whether it be the OB, the midwife, the nursing staff, residents that are going to either be doing vaginal checks or the delivery itself. Another thing that we can use in the hospital is hospital linens. So in this example, what we would do is we would take a bed sheet, tie it in a knot. We'd give mom the knotted side of the bed sheet to hold, and the healthcare provider would hold the other end. Why are we doing this? We're going to play tug of war. So this is going to help the mom get extra tension and help her to get in the correct positioning for pushing. So it'll help mom come up and curl up over herself so that she's able to push in the most optimal position. The combination of using all of these tools that we have within the hospital and tools we bring from outside of the hospital, such as the rebozo we talked about, a TENS machine, birthing ball, this all helps labor progress. Another factor to consider within labor, before I move on to postpartum comfort measures, is that in the delivery space, there are cultural and religious expectations for birth. And I feel like that's something that maybe we don't talk about very often, but I felt that it was really important to touch upon because this is what community doulas do best. So, for example, some cultures may not wish to talk about the name of their child because a naming ceremony is going to take place and it's taboo to speak the baby's name before the baby is born or birthed. Other cultures may have a religious officiant circumcise the baby and don't want that procedure to be done in the hospital. So really the takeaway is just that it's important and to know what is important to the birthing person and relevant to the birthing person to eliminate insensitivities that may occur. And it also just makes for a more pleasant and personalized birthing experience. So postpartum. In terms of morbidity and mortality, the postpartum period is the most vital time of pregnancy and the birth journey. And this is the time when doula care and support and attentiveness is crucial. According to the CDC, 1 in 3 pregnancy related deaths occurs 1 week to 1 year after delivery. This is why it's imperative to discuss the warning signs a birthing person should look out for, and this is what community doulas do in their postpartum visit. So, namely, this would mean, hey, be on the watch out for soaking through more than 1 pad per hour. Want to make sure that you don't have a fever higher than 100.4 degrees Fahrenheit. If you have chills, if you have an infection, if you're passing clots bigger than a quarter, or anything else that the healthcare provider has informed you of, we're just going to reiterate that and in this period. It's also a time for nurturing for mom and baby and the entire family. So this is the time, like I've said before, where I'll take the older children that may be in the household or take the newborn if they're first-time parents and allow them to get some sleep. I'll go and I'll meal prep with them. I'll discuss proper nutrition so that it supports healing for the mom and meets the increasing demand that breastfeeding can put on the body. I'll also follow up with lactation support that would have been initiated in the hospital. So just be checking their match, see if they're having any other concerns that I can address. And I also want to make sure that there's that support system in place. So prenatally, we would have talked about who's going to be there making meals, who's going to be there washing the bottles, all of those things. So that can look like following up with a SNAP application, creating an actual meal train where different people are bringing meals to the parents at different time or to the mom, interviewing childcare providers, giving questions that can be asked to the pediatrician, going over what the vaccine schedule would look like, all of those types of things. So here we see, Daddy, we see you, love this graphic, and it's just basically saying any partner, we see you. We see that you're also up at night. We see that you're supporting your partner. We see that you're being nurturing and effective. I think this is also a really great time to highlight what's going on with the partners as well. I have an example of how and why nutrition is super important. So I had a client who has gestational diabetes. So she was really, really discouraged. It was like, oh my gosh, I really want to have a vaginal birth. I know I'm probably going to have a C-section because I have gestational diabetes, but I want to do the most that I can to be healthy for myself and for my baby. So what I did is I partnered with a registered dietitian and I came over and we just created a whole month of meal plans. I was like, what's your budget? All right, let's do this. And I went over and I cooked salmon and kale salad together. So that's the type of exchange and intimacy that's created kind of with a community doula, where you're meeting the unique needs of the mama in a way that your OB is not, right? So your OB or your midwife may say, hey, you have gestational diabetes. Here's a list of proteins that you can have. Here's a list of carbohydrates that you can have in moderation. These are the types of non-starchy vegetables that you can have. But that's a very different thing than let's cook some salmon and kale together, right? So that's what makes super unique. Let's go into why doula care is a partnership, not only between the family, the birthing person, but also between the healthcare practitioners and the health system itself. So doulas help support professionals and the birthing person by being an extra set of hands, by reinforcing the care that's needed, by addressing concerns that the mom may have and bringing that up to the healthcare practitioner. So, for example, if you're an RN on the L&D unit, you have 4 patients at the same time, all 4 patients need something in the same moment, use us. We're there. I'll get an extra blanket for you. I'll get ice, whatever I can be an extra set of hands for. Absolutely. More than happy to do that. Also, when you have a situation where there are resources that are limited or have run out. So I was on L&D and my mama loved hot packs and they ran out of hot packs in L&D. So she's like, oh my goodness, what am I going to do? So what I did is I took a towel, I wet it, stuck it in the microwave for a few minutes, put it in a Ziploc bag that I had in my Doula bag, and voila, instant hot pack. So we're maximizing the resources that are within the hospital to make for a pleasant birth experience. Reinforcing the healthcare provider-patient relationship. Let me set the tone for this particular one. So I had a client who was unfortunately a victim of sexual assault. So in her birth plan, she had requested minimal vaginal checks, which was already a standard of care for that particular hospital. The doctor came in and it was not the regular OB, it was the OB on call at the time, and was a male, and said, hey, I have to do a vaginal check. The mom was just completely beside herself. So I asked for a minute and I spoke to the mom and said, hey, look, this is your body. You never lose your autonomy. This is a safe space and you're going to be respected. What I would advise is why don't you ask and identify if and why a vaginal check would be medically necessary. I also reminded her that within the last hour, her baby had experienced some decels in the heart rate, and that may be why the doctor chose to come in at that moment. But I wanted her to find out for herself. The provider very graciously took the time out to explain why a vaginal check was required at that particular moment, what they do, what they're looking for, and she very happily after that consented. So we took a moment that could have been very traumatizing, re-traumatizing, very triggering, and turned it into a very positive situation. Redirecting intention. What is this? So sometimes a healthcare provider can come from a room where it was just a really tough experience. Maybe there was something very jolting and jarring that happened in that previous patient's room, and now they're coming into a scenario where you have a patient who is asking a question and you're just not in the right mind frame to be able to answer that. I'm more than happy to say, hey, can we explain that? Hey, can we give them a minute? Hey, don't forget the intention is healthy baby, healthy mom, because that's what everyone wants at the end of the day. We don't want to have these statistics where women are dying and families are growing up without a partner and without a mom, right? We don't want to take that 3 and 5 statistic where there's preventable causes to the pregnancy related deaths and not prevent them, right? So redirecting intention in the room is exactly how community doulas are actively changing that metric. So I also wanted to talk about a little bit about health equity in redirecting attention. So in training, we talk about systemic racism and internalized racism that the person may be feeling, things like that, that directly attribute to a negative birthing experience. So doulas are trained to make sure that the voice of the patient is being heard. And I know that healthcare providers and practitioners all are striving for the same goal. And it's just another person to help reiterate how important it is that we have that goal. So together, doulas and healthcare practitioners have the power to mitigate maternal infant morbidity and mortality crisis. We have the power to change and create positivity. We have the power to educate, to advocate, and to just create a wonderful experience for these people, these mamas, these birthing persons. And I would challenge all of you today to do something that I call the Liz Taylor Pledge. What is the Liz Taylor Pledge? Well, it's take it easy, EASY. So E stands for education, which is what you're doing today. Educate yourself. Help provide evidence-based care. A is for accountability. Hold yourself accountable and your colleagues accountable. S is for small, actionable steps. Little by little, we will go far together as a team. And Y is for you versus patient-centered care. So you're asking yourself, is this about me or am I doing what's best for the patient? So EASY, take it easy. Let's be the change that we want to see. Let's doula this. Thank you so much.
Thank you, Elizabeth, for such a wonderful and comprehensive presentation. And now we're going to take questions from the audience. So the question box is still open. So feel free to continue to submit your questions. But I do have, excuse me, I do have some questions right now. I don't know. Okay, here we go. I have some questions to ask right now. So what role does the doula play in health equity? You know, you talked a bit about that. Yeah.
So I feel oftentimes there are certain just injustices that have been done, right? So we'll talk about, for example, systemic racism. If I'm in training as a doctor or nurse, I'm learning about what it looks like to be burned, right? In my textbook, if I'm looking at the first degree, second degree, different types of degrees of burns, if I'm looking on that on a skin tone that is not like my own, or a skin tone that, doesn't cover everyone, well, that's a disservice to me. That's exactly how systemic racism occurs. Also, I know in the nursing text by McGraw-Hill, there's an excerpt that talks about pain management and how different pain is perceived differently in different cultures. So it verbatim says African Americans or people from African descent do not feel pain in the same way, that they have a higher threshold for pain. That's just inaccurate and has since been repealed, and they have since apologized for even having that in their text. But again, if that's something that you're taught, that's a problem. So what we're doing is we're helping to address those type of concerns. So what I'm doing is educating myself on what it looks like when I've turned blue, when I'm pale, right? What does that look like on my skin tone? So I can identify to the healthcare practitioner that, this isn't her normal coloration. Or, I don't think that's how this should look, and this is why. I know you may be used to a purple coloration or this type of coloration, but it's actually going to look more maroon or more this color. So that's just one way that doulas can help and with health equity.
Thank you. So my next question is, what is the role of the full spectrum doula to family-centered care, especially involving the partner?
So that's a great question. I love partner work. So we did a little bit in our hypothetical scenario of a belly lift and the slow dancing, right? So it's a great time to make sure that everybody feels involved. I feel like a lot of times the partner is left out. Like, it's totally about the birthing person and their experience, as it should be. Growing a tiny human is no joke, right? It takes a long time, it takes a lot of effort to deliver, and it takes a lot of hands from, the healthcare providers and the doula and the mom all working in collaboration to have a healthy birth. So doulas want to make sure that the partner is not forgotten in that. They want to incorporate them in the comfort measures. Let's incorporate them in creating fun meals together. Let's incorporate them on how can you create a schedule? What are things that you can do to help be supportive? So we find creative and fun ways to incorporate that all throughout the process.
Okay, thank you for that answer. My next question is Health Connect One a legitimate certifying body?
Okay, so this is a great question, because really I think I'm going to answer that question with a different framework. How do you identify what a legitimate certifying body is? So you can actually go to the New Jersey Department of Health website, and they have all of the certifying bodies for doulas in New Jersey. And I've listed Uzazi Village, I've listed Dona, as a certifying body. So I would actually challenge to go onto the website where you can find all of the qualified certifying bodies, because yes, there are doulas that are non-certified that hold the doula title, and there are certifying bodies who claim to certify that do not have the same credibility or weight as other agencies.
Okay, thank you for that response. Do families with private health insurance also benefit from, it says, no cost doula services?
Oh, I think I understand what you're asking. So there have been several pilot programs where there was grant funding in order to provide doula services. Some of those still exist. However, if you have private insurance, it would be like any other service. It's a fee for service. So your insurance would be paying for that particular service. And
So,
we're getting there is how I will leave that. Right now, we're not there yet, but we are getting there.
yeah. So there was a follow-up to that question. Can a family not on Medicaid have a community doula? And if so, is there a cost?
Yes and yes. Yes, you can have a community doula, and yes, there would be an out-of-pocket cost.
Okay. Can you talk about specific community doula programs in North Jersey? And how do low income women access these programs?
So I was a part of Sister to Sister Community Doulas of Essex County, which I alluded to earlier. There's the Pattison Collaborative that's happening, right? So those are the doulas that are in Northern Jersey. And then what was the second part of the question?
How do low income women access these programs?
So, in general, you can research and find the numbers for those particular programs. But also, if you have Medicaid, you can actually call the 1-800 number on the back of your Medicaid card and get a doula that way, because there are doulas who accept Medicaid. If you are a low income family that is uninsured, then I would advise you to reach out to those specific agencies so they can put you in contact with either themselves, like the doulas within their agency, or another community doula that may be outside of their agency.
Okay. This question is, I guess, for you. Well, it is for you, and it is, how do you balance doula care with hospital policy? How do you balance that?
Okay, this is very interesting, and it takes some zhuzhing. So first, I want to familiarize myself with what that hospital policy is, right? The bottom line is everyone, like I said, wants healthy mom and healthy baby. That's the bottom line. So I think what this is asking is if there's something where, for example, I can't bring in a birth ball, you can't bring in any outside things because maybe COVID, I'll use that as an example, or you have to wear a mask the entire time because of COVID. being at births where that is the case or has been the case, or even being virtual where I've assisted and that was the case, is a hard pill to swallow. So what I would do, I obviously want to be respectful of the hospital's policies. They're there for a reason. I often feel like sometimes it's to err on the side of caution, right? Because you are the healthcare entity, the provider, and you don't want anything bad to happen to the patient. So that's why the policies are put in place. But wherever there's some wiggle room, I will find it. And what I mean by that is, for example, the room may be small and the mom may not be able to get up, and they're like, listen, no one's allowed outside of the room because of COVID, so you got to stay in here, you got to stay put. But that doesn't mean that we can't move. So what I'm going to do is we're still going to get mom up. We're going to get her moving. If she can only move when she goes to the bathroom, we're going to the bathroom every 5 minutes because that's what the policy says. So wherever there's a little bit of wiggle room, we will find it.
Okay. So, you know, you did speak about culture a bit in your presentation. You know, we know the face of birthing is changing in terms of who is giving birth. And so I'd like to ask you about any experiences or just any comments that you can give when supporting same sex couples in this birthing space.
Absolutely. So the major thing is language, because there is so much power in our language. So one, I want to make sure that when I'm dealing with anybody, doesn't matter, same sex, otherwise, would you like to be addressed? Right? Is the modicum, because quite honestly, it doesn't matter. Right? Right? Doesn't matter if you're same sex, it doesn't matter if you're blue, purple, orange, yellow, red, black, white, Asian, doesn't matter. Right? So I want to start with, how do you want to be addressed, and make sure that that's clear to everyone. Are you mom and mom? Are you mommy and mama? Whatever it is that you know, or are you dad and dad? That also happens. Whatever it is, right? You know, whatever it is, I want to make sure that we've ironed that out. Then I want to make sure that you have education about the process, because I feel like there's a lot of apprehension around respect for that particular partnership. So making sure that that's respected. And then I want to alleviate the anxiety and the fears that go along with not knowing how to navigate the birthing space and the birthing process. So the more education we give, the more information we give, the more prepared we make our families, the less anxiety we'll have. We'll be able to effectively communicate in situations. And like I was talking about before, prenatally, how we come up with a birth plan, right? So you have this plan that you and your partner have come up with. And I always say that nothing goes to plan. So we try to have, you know, if we can do 100% of your birth plan, that is amazing. If we can do 50% of your birth plan, that is amazing. The goal is to make sure that you know what your options are, that you knew what to expect going into that situation. So dealing with same-sex couples, I feel like, is kind of a loaded question, because it really isn't different to me. People are people.
Okay. Another question is, have you had any personal experience with a surrogate pregnancy? Or can you know, who is involved in that and how do we make that work? Similarly to what you just mentioned, but I think it's just a bit different. Yeah.
So the one surrogate birth I did was very complicated, because it was a couple that had initiated the surrogacy and then was going through a divorce. So that was like multi-layered there. So it was definitely a very tense situation. So, but anyway, with surrogacy, it's just a matter. There's a lot of apprehension with pulling out, right? So you've done all of this preparation. This couple that I'm talking about actually did IVF and had harvested eggs, but had to have donor sperm and had to use a surrogate. to create the embryo. So it's just navigating that whole process. There's a lot that goes into IVF. That's a long time. It's a lot of support. It's a lot of daily medications. There's actually a course you take on how to administer the medications. It may be the first time that this person is giving themselves injections. And then the timing of that, you have to be available at a certain time to give yourself the injection the same time every day. So just helping them navigate that whole process of getting up to that point. And then with the surrogate, having their emotions as well as the person who's going to be receiving the child and that family, their emotions all have to be taken into consideration. So just having an active channel for communication, setting up the expectations of I'm expecting the mom to eat a certain way because I would eat a certain way. The mom has agreed to this particular diet. I'm expecting them to go to their appointments on time. I would like to be present for the appointments. So getting as much engagement as well as possible is really important in that scenario.
Okay. And one of the whole presentation was wonderful. When we think about comfort measures, and you provided us with, some specifics, do you feel that it's necessary to have maybe some specific training on those on those particular measures? Because it's that you have measures, and it may take a minute for a person to really learn how to implement that within the birthing plan or process for their family when their family goes into labor or before.
Absolutely. And I would love the training to not only be open to doulas, but to all healthcare providers and partners as well. Because I feel like positioning is really, really important in pregnancy. Movement is very important in pregnancy, labor, and delivery, right? So these are things that, as you said, have to be settled into. It takes time for the body to dilate into a face, and we have to give the mom the support she needs to allow her body to do that. We are perfectly designed to birth. The birthing body is perfectly designed to do that. So we just need to make space and give support.
Okay, thank you. Um, is there any other comments you'd like to add as we come to the end of our presentation?
Absolutely. Well, first and foremost, I want to thank everybody for taking the time out again to be here with me. I really hope that this was informative for all of you. Um, I hope that you practice some of these comfort measures, take them back to the hospitals with you, and do this. I especially think the guided meditation is really, really useful in de-escalating a very tense situation. We can all take a deep breath, focus on our bodies, focus on our breathing. That can help relieve anxiety in many different ways. And then we can maybe ask a question again or, revisit whatever the tenseness of the situation was. So hopefully that you get to use that in the L&D world and in your own personal world.
Okay, so that's all the time we have for today. Many, many thanks to Elizabeth for that wonderful presentation and to all of you who joined us today. And I just want to remind you that you will receive a link to a post program evaluation. Your feedback is important. So, really, please take the time to comment, be thoughtful in that process. Certificates of completion will be sent via email within possibly a week or maybe a little longer. And finally, I'd like to add a calendar of partnership upcoming virtual programs can be found at www.pmch.org under the professional education tab. Thank you, and we certainly hope you will join us again for future presentations. And I want to wish everybody a wonderful rest of the day and a great week.